Povar in central Harlem, New York City. Good morning, ladies and gentlemen. My name is Thandekile Konashevsky. I'm a health sciences student with Excelsior College in Albany, New York, currently working on my master's degree in this program. My problem focus for my project was on poverty in the community of Central Harlem. Why this community? I was once a resident of this community, and during that time, I identified some issues that the community faced, and poverty was one of them. In my presentation, I will provide the background on the problem of poverty, state the ethical and legal issues, state the implications, look at the issue of poverty and how it affects the residents of Central Harlem, state some recommendations with regards to this problem. Using evidence, I'll provide ways how these recommendations can be implemented. I will state an actionable framework for addressing the problem. And finally, I will state my assessment plan. So what's the background on this issue? 46.5 million Americans live in poverty. Central Harlem is ranked as one of the poor communities in New York City. The percentage of those living in poverty is 27% in Central Harlem, compared to New York City, which has 20%, and the US with only 15%. The unemployment rate of Central Harlem is 13% compared to 11% of New York City and 5% of New York City's wealthy communities. The education attainment of Central Harlem is 39% college graduates, 41% high school graduates, and 20% high school dropouts. So what are the ethical and legal issues concerning poverty? The utilitarian theory states that actions must be chosen based on providing the most happiness for most people. But opposers of this theory believe that while there is a moral obligation to respond to everyone's needs, this standard is too demanding. Affluence and morality mention that if it is in one's power to prevent something wrong from happening, one is morally obligated to do it. Poverty violates the human dignity and the rights of those considered poor. It also inflicts a lot of harm in those exposed to it. So morally, everyone deserves a chance in life. So what are the implications concerning the issue of poverty? Poverty has remained an inconsistent shared experience in America. The community of Central Harlem is affected by social determinants like lower income, poor education, unemployment, and lack of necessary resources like health insurance. While poverty rates have declined in our society, some groups still experience economic hardship. Central Harlem is the second poorest community in Manhattan that experiences economic hardships. People who live in poor communities experience more negative health problems, have a low life expectancy, and experience high mortality rates. Employment is a critical factor for a family's economic well-being. For those working full-time, poverty rates are low, and for those working part-time or not working at all, poverty rates are high. So what are the negative effects of poverty in Central Harlem? Central Harlem faces a lot of chronic diseases that include asthma, diabetes, heart disease, hypertension, cancer, and the list goes on, compared to wealthy communities in New York City. The median household income of this community is $36,807 annually, which is lower than the New York City of $51,865 annual. The percentage of people living below the poverty line is 27%, which is higher than the rest of the New York City of 20%. The rent burden in this community is 49% higher than the 37% of the best performing district. 19% in Central Harlem have no health insurance compared to 8% of the affluent neighborhoods in New York City. 11% in this community go without needed medical care compared to 5% of the wealthy areas. 12.3% in Central Harlem had late or no prenatal care compared to 1.3% of the most affluent communities. So what are the recommendations concerning this issue? Policies that encourage economic equity should be implemented. Job creation is essential because it helps the unemployed find work to provide for their families and get benefits like health insurance. Raising the minimum wage is also important because it will help those in poor communities and reduce poverty rates and improve health outcomes. Education is another recommendation because it could reduce poverty within communities and the bondage of poverty. Minimizing mass incarceration is another recommendation because poor people have a high chance of spending time in prison, and being in prison leads to poverty. Another recommendation is correcting social injustice. Closing the gap on racial and ethnic inequalities is essential in ending poverty. So how do we implement these recommendations? We take action on a variety of administrative activities that will have significant positive impact on low-income communities and populations. We create a cross-agency working group that will coordinate and increase awareness of federal efforts to address poverty and inequality in America. A national commitment to ending poverty should be made that will target hunger, housing, education, and health. We should also remember that there is a personal responsibility in ending poverty through better choices by individuals and better policies and investment by the government. A strategy needs to be put in place that will help those who are poor get out of poverty and eliminate conditions that allow poverty to persist. So, what's the framework for addressing this issue? We need to implement a poverty reduction goal and a timeline to achieve it. We need to make sure all jobs provide a standard of living above the poverty line. As a nation, we need to improve federal working support programs like tax credits, nutrition assistance, and the healthcare for all low-income families. The timeline of these changes depends on how long this problem has been present in this community. One cannot change an issue that has been ongoing overnight. It could take years to eliminate poverty in the community of Central Harlem, but what matters is progress that will benefit every community member in the long run. So what is the assessment plan on this issue of poverty? Our nation needs to set a goal to end poverty by targeting measures that will show whether the country is making progress on this issue. The desired outcome is to end poverty, but many individuals and communities like Central Harlem still face poverty and its adverse consequences. Getting rid of poverty within a community is a combined effort. No single organization can successfully eliminate this issue on its own. So by aligning the efforts of several organizations, we can make sure that every subset of the community is reached. Continuing on with the assessment plan, Central Harlem has a population of about 118,000 individuals. 62% of the individuals are Black. 23% are Hispanic, 10% are white, 3% are Asian, 3% are defined as other. Putting in mind the demographics of this community will help in identifying ways of getting rid of poverty or reducing it. So I conclude by saying ending poverty requires a team effort because it cannot be fixed by just a part of our society. All individuals, from the poor and those who are not, the policymakers, and our federal government need to get involved. Ending issues like poverty strengthens our communities and our nation, and it unites us.